When you think of Las Vegas, you might think of gambling, the Strip, or showgirls.
Vegas, baby!
What you probably don't think of
Do I feel lucky?
is emerging medical technologies. From now on, that's going to change. This technological breakthrough happening in Las Vegas is medical stereolithography. It translates high-resolution CT imaging into anatomically accurate 3D models. Exact replicas of body parts physicians can see, touch, and feel to diagnose problems and plan surgeries. Hips, spines, brains, skulls, any bone or organ that can be scanned can be replicated into a 3D model in about 5 hours.
The technology allowing us to make lifelike three-dimensional models, in my opinion, is one of the most fantastic technologies that I've ever encountered. The ability for me to hold in my hands and look at, literally look at, the things that I see on X-rays or on CT scans, MRI scans, is incredible.
I've taken a technology that is very popular technology in the engineering world, product design, somewhat in the architecture world, and I've brought that technology into the medical field. I didn't invent CT and I didn't invent this printing technology. I just brought the two together.
We pretty much can CT just about anything depending on what accuracy we want. So we use it for any type of trauma patient to easily diagnose if there's been a trauma. We use it for perfusion scans of the brain. We can do cardiac scans where we look at the heart. Typical, any three-dimensional scan you need to look at, and preferably if you're trying to distinguish between bone and soft tissue. But what is unique about this aspect is now you're coupling the CT images with a three-dimensional reconstruction of the bone anatomy, and that hasn't really been applied to the medical field. So you can get a true 3D representation of what you have a 2D image of.
What's happening here is the printer is putting down a layer of binder or a glue. And once it puts the glue down, it will go back and take another layer of powder and drag it across, just like bringing another sheet of paper across. What it's doing is it's printing hundreds of layers two-dimensionally until you have a three-dimensional object.
Having been acquainted with this technology now, I would not want to tackle a complex congenital spine deformity, anticipating a vertebral resection or a pedicle subtraction osteotomy without having this technology available to think about, to look at, to plan, and then intraoperatively to be able to refer to. I think that it definitely, for me, gives me a comfort level that I've just never had before.
It's a whole new dimension, literally, of how we can present the work that we do. It's something that can be immediately appreciated by the patients and immediately appreciated by their physicians. Something that when you have a very complex disorder or a very complicated disorder, if you're looking at it on an X-ray film or a computer, that can be difficult to understand. The ability to literally hold this child's skull in my hand and have it be an exact duplicate is a tremendous advantage for me in making a diagnosis. It's a phenomenal advantage for a neurosurgeon who's planning surgery and also trying to explain what's wrong with the child.
Parents are amazed, patients are amazed to be able to look at and feel the spine. The nurses and the doctors, the anesthesiologists, any assisting help in the OR, it gathers a crowd. You know, people come from other operating rooms and wander in, to my dismay, and kind of want to know what's going on in this operating room. What's this model all about? And it really is truly an amazing technology. The nice thing about these models is you can actually take them apart and see exactly what we need to resect. The anatomy is exactly the same as you see here. Once you make the exposure, and all we really see on the exposure is just the back of the spine with some dissection around the sides, and so you just see a very minimal amount. You don't really ever see the piece visually in surgery like you see it here. So this really does help.
I see spine disorders that are so severe at times that even with the most sophisticated traditional 3D modeling on a computer, I still can barely figure out what's going on. I take this in my hand and instantly I can see what the problem is, the surgeons can see what the problem is. It makes the diagnosis more accurate, it makes the treatment more accurate. In my opinion, it's a phenomenal advance in medical technology.
In some circumstances, I've actually done the surgery on the model in anticipation of the surgical treatment of the patient. So this was a model that we operated on preoperatively, just so we could find out where those pedicles all were in a distorted spine. It's also extremely helpful as you present this model to the family. They often are a little confused with x-rays, but the model is right there for them to pull apart and rotate and touch and feel and see. So it's very helpful for families to get oriented and understand what the surgeon's doing.
We're using it now for pre- and post-operative evaluation, for making diagnoses of more difficult conditions. But I think that for the ability for us to look at perhaps where disease processes are going to occur by looking at structural abnormalities. I mean, this technology can be used to recreate in an actual patient their anatomy exactly as it is. We can then look at areas of stress, areas of strain, all kinds of things that I think are possible with this technology that are yet untapped.
And it gives me an opportunity to offer surgical treatment to patients that didn't have options before. It's not like these surgical treatments is such that you can send them off to somewhere else. I just don't know that there's anywhere else in the country where this type of cooperative effort is really accomplished.
Anything that improves our diagnostic capability and improves our ability to give more information to the treating physicians will not only save time for the patients and save money for the patients, but it also saves them from the standpoint of any kind of complications, or decreases the likelihood that they're going to have complications and increases the likelihood that they're going to have a good outcome. The better we can present this information, the better we can understand the information, the better care we can provide.
These are 6, 8, 10-hour procedures, and time is probably saved, but what really is saved is years off of my life, because it's comforting and it's secure. The anxiety level is much lower as you approach these complex deformities.
And in the long run, this technology will always, I think, result in a savings for the healthcare system and the patient, because we get a more accurate diagnosis and we're able to give a better, more accurate treatment, which means a better outcome.
I was in an automobile accident a number of years ago, and it's almost karmic to have been through that and to come back and do this type of work. I'm very passionate about the work because I know what I went through for over a year after my accident, and to be able to come back and to help people and to help patients and to help physicians make better diagnosis is very rewarding to me. And I think that this technology should absolutely become the standard of care and not the exception of care.